Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. What is Biktarvy used for? Biktarvy is a tablet that contains 3 different antiviral medicines and is used to treat people infected with the HIV-1 virus, human immunodeficiency virus type 1. Biktarvy can be used in patients weighing at least 14 kilograms who have never taken antiretroviral medicines, or are replacing their current antiretroviral, ARV, medicines that they are stable on and their virus levels are suppressed, which means that the HIV-1 virus levels are less than 50 copies per milliliter, and they have no known or suspected substitutions associated with resistance to bictegravir or tenofovir. This means that Biktarvy can be used to treat people with HIV who have suppressed viral loads with known or suspected M184V/I resistance. When specific antiviral medicines are used in conjunction with safe sex practices to prevent HIV infection, it is called pre-exposure prophylaxis, PrEP. Biktarvy is not used as PrEP. What does HIV do to the body? HIV is complicated in how and where it affects the body, but a simple version of what it does is: HIV, human immunodeficiency virus, is a retrovirus which specifically attacks the CD Tcells in the immune system. When first infected with HIV, you may not have any symptoms, but after 2 to 4 weeks people often get vague influenza, or non-specific symptoms that last only a few weeks. Over time, if HIV is not treated, the HIV virus can become high, which means the CD Tcells levels become low. As CD Tcells are part of the immune system, it is harder for the body to fight infections and illness. You become more likely to get bacterial, fungal, viral and parasite infections and cancers that are related to viral infections. This stage of HIV infection may be called AIDS, acquired immunodeficiency syndrome. Most people treated for HIV do not progress to AIDS. Related questions: which medicines should not be taken with Biktarvy? Can Biktarvy be used for PrEP or PrEP? What if I miss a dose of Biktarvy? What effect does Biktarvy have on HIV? Biktarvy contains 3 antiretroviral medicines, emtricitabine, tenofovir, alafenamide, bictegravir, that work together to treat HIV infection by reducing the number of HIV viruses in the blood to an undetectable level, which is less than 50 copies per milliliter. This means you are less likely to pass HIV to another person. With less viruses in the body, the CD Tcell count increases, so that the immune system is more able to fight infection and illness, which keeps you well. HIV virus can evolve and change so that HIV medicine no longer works on it, the virus becomes drug resistant. By taking Biktarvy regularly and keeping viral numbers low, it means that there is a smaller chance of the HIV virus becoming drug resistant. Bottom line: Biktarvy is used for HIV-1 treatment in adults and pediatric patients weighing at least 14 kilograms and who have never taken antiretroviral, or who have suppressed viral levels on a stable antiretroviral regimen with no known or suspected substitutions associated with resistance to bictegravir or tenofovir. Biktarvy is not used as PrEP to prevent HIV in at-risk people. RxCardClub.com. Get a free prescription drug card and save up to 80% on prescription drugs.